Here's the deal. Some people look at this chart and say, that's a social drinker. Other people look at that chart and say, there's no way I could possibly consume that much alcohol. And that's my point. The BAC chart is nothing more than a hypothetical guide. You know what you could do? If you could just post right in your entrance to your establishments, a great big poster of the BAC chart. You got scales there. Your guests walk in, they step on the scales, you walk over, look how many drinks they can have, write that number in a post-it note, slap it on their head, send them on in. Because other things will factor into the absorbency rate of alcohol that the BAC chart does not consider, such as, were they drinking before they came in? How fast are they drinking? What are they drinking? How has that drink been mixed? Is it a warm or is it a cold beverage? Are they hungry? Are they dieting? What is their emotional state? Your emotions will change the chemistry of your body at any given point in time during the day. People are tired, depressed. They will come down with feel the effects of the alcohol faster than someone who's in a very good mood and maybe very angry. Tolerance, that's huge. There's some people out there who are professional alcoholics. I personally know some people who could literally take a breathalyzer, blow into a breathalyzer, you'd be looking at them going, how are you standing? I know some people, one drink, good night, Irene. Medication and alcohol. Obviously, pain pills and alcohol, not so much. But then you break it down to something as simple as over-the-counter cold medicine. You ever had a bad head cold? You take that cold medicine and get through the day, and after work you have yourself a drink and you're thinking, wow, I just think like this more often. It's much cheaper. Drugs and alcohol. Cocaine and alcohol can increase the heart rate and affects coordination and attitude. Marijuana and alcohol slows reaction time considerably. Caffeine and alcohol creates a false sense of sobriety and insomnia. Amphetamines and alcohol creates forgetfulness, causing the person to take more of the drug, which can cause an overdose. Over-the-counter sleeping pills combined with alcohol can cause death. Club drugs mixed with small doses of alcohol can cause death and have been used as a date rape drug, such as GHB, ecstasy, ketamine, and Rohypnol. These four can cause an individual to lose control of muscles, drowsiness, and loss of memory. The above four mentioned drugs have all been used as a date rape drug, but alcohol is the #1 date rape drug because various studies have determined that over 50% of the men who commit rape are under the influence of alcohol, while over 50% of the women raped were under the influence of alcohol. Alcohol poisoning. Alcohol depresses nerves that control involuntary actions such as breathing and the gag reflex, which prevents choking. A fatal dose of alcohol will eventually stop these functions. It is common for someone who consumed excessive alcohol to vomit, since alcohol is an irritant to the stomach. There is also the danger of choking on vomit, which could cause death by asphyxiation in a person who is not conscious because of intoxication. Here are the signs and symptoms of alcohol poisoning. Mental confusion, stupor, coma, or the person cannot be roused. Vomiting, slow breathing, fewer than 8 breaths per minute. Irregular breathing, 10 seconds or more between breaths. Hypothermia, which would be low blood temperature. They'll have a bluish skin color or a paleness. If you suspect someone has alcohol poisoning, know the danger signals. Do not wait for all symptoms to be present. Do not leave a person who passes out to sleep it off. Be aware that a person who has passed out might die. If there is any suspicion of an alcohol overdose, call 911 for help. Do not try to guess the level of drunkenness. If they look like they need help, they need help. If alcohol poisoning goes untreated, well, the victim may choke on his or her own vomit. The breathing slows, becomes irregular, or stops. Heart beats irregularly or stops. The hypothermia may occur. Hypoglycemia, too little blood sugar, leads to seizures. Untreated severe dehydration from vomiting can cause seizures, permanent brain damage, or death. Note, binge drinking, the consumption of 5 or more drinks in a row by men or 4 or more drinks in a row by women within a 2-hour period is especially dangerous because the victim can ingest a fatal dose of alcohol before becoming unconscious. Also, you need to be aware of those with disabilities. It can be very embarrassing to both parties. Examples of this could be somebody who had a stroke victim, diabetics, injuries of some kinds, surgery, cerebral palsy, multiple sclerosis. What you as a server want to do, you want to slow up how fast the alcohol can actually absorb into that person's bloodstream. There's 3 ways you can actively participate in this. One is with time. You simply pace your service. They don't get that drink unless you bring it to them, let them finish the drink, remove the old glass, then you can bring them out a fresh cocktail. 2 things happen there. One, you as a server, you're pacing how fast they can get the alcohol, and number 2, that's a form of better service. When you drop that check, at the end of that dining experience, that check and a couple glasses of water is all that needs to be left on that table. All the other flatware, plateware, stemware needs to be pulled. The second way to slow up the alcohol absorbency rate is with get your guests to drink something besides alcohol. An alternate beverage, juices, sodas, coffee. Water's your best ally for the pure simple fact they will drink it. Have you ever noticed when somebody begins to get intoxicated, they'll drink faster? Well, it's because they're dehydrated. They want a fluid. Give them water, they will drink that water. Remind them, you'll feel better tomorrow. It's a trick. And the third, and one of the most effective ways to slow up the alcohol absorbency rate is with food. Food is one of the best ways to slow up the absorption rate of the alcohol. When you get your guests to eat food, 3 really good things are going to happen. 1, it will increase your check average, which will increase your tip. Number 2, it's good for your working at, your selling product. And number 3, it will help slow the absorbency rate for your guest.